Hi, my name is Jen Schlebusch and I work for the Behavioral Response Team. Today we're going to talk a little bit about being the person to walk into your patient's room and do a belonging search. Some resources available to you as the bedside nurse are a PowerPoint presentation on Q12 room searches, a video discussion of the behavioral health hour on those Q12 room searches, and the room safety form, which you can find on eLibrary. These are some things that may be helpful to review before you go in to do your room search. When you're doing a room and belonging search, you may do them with a partner, a change of shift, or you may do them on your own. What's important when you go into the room is to introduce yourself to the patient if you haven't already, and allow them to know what you're there for. What you really want to present to the patient is that you're doing this for safety's sake, and that this is something that we do regularly and is part of our practice. So when you're looking around the room, you can engage the patient, and talking about their day and planning for their day. And you can take that opportunity also to build a little bit of rapport with your patient. And when you're moving around the room, you really want to be scanning for things that may be unsafe, that may have come into the room since you were last present, or things that may have come in with the parent who came in to visit today, or come in with a lunch tray or an activity that just no longer need to be in that space. For example, when I walk into a room, I'm often scanning for utensils and things that go on a food tray that can be removed from the room. Or pens, sometimes pens are left behind. And so really just collecting those things and engaging the patient, while you're doing it, again, to illustrate safety. Some things in this space that I would remove for sure are the bedside phone that has a long cord on it, and that may have been left in here when the patient transferred, or perhaps also the patient wasn't here admitted for behavioral health reasons in the beginning of their stay and has since become a person who's boarding for a higher level of care. And at this point we would want to minimize risk in this space, and so that phone would want to come out of the room. And for the cords on the monitor, as long as the patient's not requiring the monitor extensively, you can simply bundle the cords and zip tie them, and you can get zip ties from our facilities here. As far as the nurse call light goes, that's something that needs to remain in the room. But if you are concerned for ligature risk, then that's something that the sitter can actually hang on to as they sit by the bed. In this space also we have one of our mobile computers, and that's something that we would want to remove from the space as well, for a lot of different risky reasons. We have cords and we have things that can be broken, and we want to make sure that that's just not inside the room. Additionally, in the same vein as the monitor, if your patient isn't requiring the suction that is below it, that's something that we would remove from the room as well, simply because it's long tubing, and that could also be a risk. The bedside tables are something that you should check, because some of our older bedside tables have a compartment underneath them that can open, and even some of the oldest ones have a mirror inside of there. So if this bedside table contained any of those things, we would want to remove that as well. So when you're doing your belongings and room search and you enter a room and your patient has some different concerns for ligature risk, or perhaps has, suicidal ideation, and you find some objects like this in the room, these are things you're going to want to remove as well. The mobile computer, because of the cords, this PlayStation controller, if the patient isn't already approved to play with it, then that might be something you want to remove. Trash cans that have liners and trash bags, such as this one and the one that are in the bathroom, are things that we typically remove as well for those patients. And if that hasn't already been discussed for your patient, then that might be something to bring back to the team. There are different things in here to be aware of as well. If your patient has shower curtains that have these metal rings, and they have concerns for potential self-harm behaviors or scratching or cutting, those are something that you may want to discuss with the team taking out as well, as they are metal and easily removable. In addition, the shower head with the long cord is something that sometimes we simply zip tie so that it's no longer a ligature risk. These are some things that you can talk about when you're doing your room safety if you find them when you're doing it. One additional risk for our patients on suicide precautions are, all of the ligature risks. And while these pose some ligature risk as well, these typically we would not remove initially, but that can be a discussion with the team. This hook is easily removable, and we would remove this if we called engineering to come up and remove other things as well, because it's simply applied with a couple of screws and that can come out. Anything that's really more nuanced for your patient should really be discussed with the whole team. You, of course, as the nurse with the patient, can make the decisions on room safety, but we always advise that it be a team discussion if at any point it goes deeper than that. Another part of the search, other than the physical environment, is the patient's belongings. And so when they come up to the floor and they're admitted, their belongings have already had a search preliminarily, typically in the emergency department, or maybe if they're coming from the ICU, that's happened up there as well. But you're going to want to make sure that you're checking those things when the patient comes to you on the floor, and then also as part of this room and belonging search. This bedside chest of drawers is something that we typically put just outside the door in the hallway if the yellow carts that look very similar to this are not available from distribution. The yellow carts, I think we only have a few of them in-house, but they're specifically for this purpose, and you can order them at any time. In lieu of those, we do use these very frequently. And so the patient's belongings and things that you take from the room, such as potentially this phone, can be stored in here and just outside the room so that they don't really get lost or misplaced, and then they come right back into this room when the patient discharges. Additionally, the patient's belongings may be deemed safe, but still be stored in this out in the hallway. Or if there are items that the patient is not allowed to have in this space, they can be stored in this and left just in the hallway. In the cabinets is where we would allow the patient to store their belongings that have been deemed safe, such as clothing that does not have drawstrings or cords or any sharp pieces to it. Personal items, patients can always have books, and coloring items, but the coloring implements such as pens, pencils, markers should be cleared with the team based on the patient's safety. Some items are safer than others, and so that's why it's always a really good discussion about different things in regard to room safety after you do the preliminary things. Additionally, this cabinet has 3 of those hooks that we saw in the bathroom, and if this patient is at high risk for any of the ligature elements in the room, we should have these removed as well when they come and remove the one from the bathroom. So when you're doing the belonging search and actually looking in the different places that you want to be looking, again, it's really nice if you can engage the patient and maybe take the opportunity to change their sheets or make the bed. Always make sure that when you're beginning a belongings search that you're wearing gloves and that you never put your hands where your eyes can't see. If there's an area where your eyes can't see, make sure that you're really looking in there, or even use an implement instead of your fingers to reach into it. If the patient is in the bed and you can't take that opportunity to change the sheets and you just want to take a quick look, places you're going to want to look are just under the fitted sheet, under any of the blankets, and under the pillow. You want to do a quick sweep with your hands, again, when you can see what you're doing. And you're going to want to make sure that you're going to check inside any of the drawers, inside any of the cabinets, underneath that bedside table to make sure that it doesn't have a compartment, and on the shelves and the desks that are built into the walls in the room. And some rooms on this side have a window bench as well. This one does not, but you would want to take a look in the chair here and under the cushion if there was a window bench. So that's going to conclude our video for today for basic room searches. And if you'd like more guidance and some more references, you can always look up the room safety form on eLibrary, and that's the one that has the 3 tiers for room safety, and that can be a guideline and get you thinking about how you should be thinking about room safety for your specific patient. Additionally, there is the policy on room searches from Boston Children's Hospital, which you can look up online. And there is a video from the Behavioral Health Hour that we did for Q12 room searches, and that also talks about the order set that goes into place when a patient is boarding for a higher level of psychiatric care. So that'll be a really good reference for a little bit of background and a little deeper look into the order set.